500 Albertans are diagnosed with Crohn's disease every year, and the number of children diagnosed has almost doubled since 1995. Health specialist Leah Sarich here with why research to find the cause of Crohn's has just been given a big boost.
A huge boost. This is really exciting. So this is the single largest investment in the history of Crohn's research in the entire country.
Oh, wow.
Yes, so we are talking about $10 million. So this is thanks to Crohn's and Colitis Canada and the Helmsley Trust. $10 million, and it's all going to go towards something called the GEM project. So this is a Canadian-led international study, and what they're really going to do is look at the cause of Crohn's. They're going to try to find out what the cause is. So Crohn's disease is a chronic inflammatory disease of the bowel. Symptoms include abdominal pain, diarrhea, weight loss. We're familiar with these. It's usually diagnosed in young people, which is really tragic. They're at the prime of their life, and it really damages their quality of life. So it's a really serious disease, and the GEM project is really all about trying to figure out what the cause is to try to reduce that burden. So I spoke with one of the investigators because they have a team right here in Calgary.
One of the key goals of the GEM project is to really understand how genetics, environmental factors, and microbial factors interact together. The reason why that is so important is that if we can understand the cause of Crohn's disease, we can develop novel and innovative strategies to manage the disease. And additionally, if we understand the pathogenesis of the disease, we can potentially figure out ways to prevent the disease in those people who are at risk.
So just like Dr. Kaplan was saying, it's all about trying to understand the cause, and then you're able to develop new treatment options, and then maybe even prevent the disease in the first place, which would be wonderful. So to make the study work, they need participants. So what they're looking for, first-degree healthy relatives of someone with Crohn's disease. So they're looking for 5,000 participants in total.
These participants will be donating blood to help us determine if they have genes that make them susceptible for Crohn's disease. They'll also donate stool to help characterize the bugs in their gut. And they'll also answer questionnaires looking at environmental risk factors in their diet. And we plan on prospectively studying these individuals for a number of years, recognizing that some of them will develop Crohn's disease. And by comparing those who are newly diagnosed with Crohn's disease to healthy first-degree relatives who never developed the disease, we can start to identify key genetic, environmental, and microbial factors that might drive the development of Crohn's disease.
Very exciting. So this is wonderful. So far in Calgary alone, they've done really well. They've already recruited over 300 participants, and now with this new money that's announced yesterday, they're going to double that. That's the goal. In fact, I tried to sign up because my mom has Crohn's disease, but sadly I'm a little too old. They're looking for people between the ages of 6 and 35.
You're not very much too old.
Just a little, just a smidge. So the goal, of course, is to reduce that burden, as I spoke of Crohn's disease, on the patients, their families, and on the healthcare system. I asked Dr. Kaplan a little bit about what families say when they come to him, and he said, you know, because patients are so often put on medications, and then those medications stop working, and then they have to have surgery to remove the diseased tissue. It's such an enormous burden on the healthcare system, but also on the families, because as we talked about, these families, they get these diagnoses early in life. So children, usually you're diagnosed by the age of 30. So, you know, it's really when people are young and in their prime. And, you know, the big question Dr. Kaplan gets all the time is, why did this happen to me, and is it going to happen to my children? Right? So those are really big questions for which we don't have the answers. So that's what we're trying to do here. So the GEM project, all the information is on my blog. There's a great link and a great website, so have a look.
Health specialist Leah Sarich, thank you very much for this. BreakfastTelevision.ca is